So if you think about it, a lot of diseases, they're blood tests. You go to your doctor and you get your blood tested, but in many neurologic diseases, we don't have blood tests because they're basically problems with the brain, spinal cord in the case of MS. And so for the most part, we don't think of brain proteins as having access to the bloodstream. But in this case, there's a lot of literature to support the notion that when the brain is being actively damaged, microscopic amounts of neurofilament are released into the bloodstream and can be measured. The issue where this stands right now, because some people say, well, is it ready to be a blood test for MS, is that we have a technically validated assay through a company called Quanterix, and that means the assay is sensitive, it's reproducible, it's got reasonable coefficient of variation, test, retest, reproducibility. And we know that biologically that these are being released from the brain spinal cord from people with MS, but we don't really know how to use it clinically, so it needs clinical validation. And so one way to do that is to analyze cohorts, large cohorts, and see if they move in the direction you want them to move. So the people who have elevated levels of the neurofilament, do they end up having more MRI activity over the course of the next year, or down the road do they have progression on their EDSS? And so we were able to show at the cohort level some very nice relationships. But now the question is, can we look at individual patients, and is there a cutoff level that would predict who might have the likelihood of this happening to them individually? Because if you go to the doctor and give blood, you want to know what the meaning of an elevation is. So with a lot of blood tests, you have to establish what's normal and what's not normal, and so we know from many things like blood counts that at a certain level you suddenly are anemic, but if you're 0.1 below the normal range, does that mean you're really anemic? Not really. And so we're trying to figure out what is clinically meaningful, and I think this is where all of us who practice neurology, we're looking at this cohort to see if we can inform ourselves as to what would be a level that you would react to. Are these neurofilaments responsive to therapies? These are the kinds of questions that we address. So basically, we've been able to show that a level of 16 picograms per mil in the blood or greater is associated with having worse outcomes for that patient. And on an individual patient level, if you look at negative predictive value or positive predictive value, that there were significant associations with gadolinium-enhancing lesions, new T2 lesions, and as I mentioned, ultimately changes on the disability scale or the proportion of patients who reach a certain level of disability. In this case, we used the EDSS rating scale and looked at the number of patients who had gotten up to 3.5, which is a 1 to 10 scale. So these were mildly impaired patients, but it had some predictive value for telling you if they were going to get to that level. And we also found that less than 8 seems to be normal, and people in that category did very well for a period of time. And this is useful because MS is a heterogeneous disease, and not everyone has the same outcome. It's not, I was going to say, like cancer, where if your doctor says you have cancer and you're going to die in 6 or 12 months, you're going to bring out the big guns and treat it aggressively. But in MS, we know that some people will end up in a wheelchair in 5 or 10 years, and other people can go 40 years and you wouldn't even know they have MS by looking at them walking across the street. And so when you're dealing with a disease like that presents in the 20s and 30s, you would really benefit from having some prognostic biomarker to say you're having damage to your nervous system and need to go on aggressive therapy and take some risk here, or no, maybe not. It looks like you had an inflammatory event, but it didn't really seem to cause a spike in your neurofilament, so it's not causing tissue damage. Maybe we can wait. And so this is what we're thinking, and if the data so far suggests that if your levels are less than 8, that there's probably not a lot of ongoing tissue damage, and maybe you have a milder form of the disease, whereas the people, as I said, with the more aggressive form, maybe they should be on what we call high efficacy but somewhat higher risk therapies. Now, to support that, we had access to the clinical trial data from the phase 3 registration studies, and it appeared that the patients on interferon beta, which is the first-line drug did have reductions in the level of neurofilament, and we looked at the time course of that and showed that you could see the neurofilament levels drop down to a normal range in a significant proportion of patients. It wasn't a home run though, and we know that interferon beta is not a home run drug. It just reduces disease activity. So we're still left with some patients having residual elevation of their neurofilament. The story was even better with one of our high efficacy therapies called natalizumab. In that case, we were left with only 4% of the patients having elevated neurofilament. And so that is consistent with what we believe is the case clinically with that drug, is that it's a high efficacy drug and it seems to work well on clinical parameters in MRI, and now this corroborates that it actually is protecting patients from release of the neurofilament or what we think is brain tissue damage. So I think it's going to be useful, but we need more information. For example, we'd love to know how frequently to use the test. In one of the trials, the samples were collected every 3 months over the course of a year, and that did appear to enrich for people who are either doing really well or really badly, but you're also left with an intermediate group that sometimes is up and sometimes down. So what do you do with those people? Every time you do a test, you get more information, and then you have to wrestle with the fact that life isn't always black and white or as clean as we would like it to be.